Certainly a huge worry. John Casey with that report. Now, it's not only painful, but it's also a common cause of infertility, yet a lot of women don't even know they have it. Lucy Polkinghorne with an expert's opinion on endometriosis, how to manage the condition and why it's important to get an early diagnosis.
It's like being stabbed in the stomach 24 hours a day.
I think there's a common misconception out there that periods are painful, that women should just put up with it.
It's a disease.
It might sound like just women's business, but it can mean the difference between a family or no family.
It is frighteningly common.
While it's seldom discussed, 1 in 8 women have it, and majority don't know until it's too late.
Realistically, I know that the chance of me actually having a child and even being able to carry a child was quite slim.
The symptoms mean it's no surprise it so often goes undiagnosed.
Intense cramping, very heavy periods. I would find mid-cycle that I would have really bad pain, and some days you just couldn't get out of bed. It was so intense you can't stand up.
For 16 years, Tina Hankey put up with the pain until she ended up in a Melbourne hospital.
I had a ovarian cyst that actually hemorrhaged, so I was rushed in for emergency surgery and spent a week in hospital, and that was kind of the start of the cycle.
She was told she had an advanced case of endometriosis.
The endometriosis for me spread over most of my organs, my bladder, my bowel, across the uterus. I had it quite severely.
Endometriosis is a condition where you see deposits of tissue that look like the normal lining tissue that's shed every month in your period, sitting on structures outside the uterus. Those deposits remain and continue to grow and can produce factors that cause scarring and pain.
Adelaide gynaecologist Dr Ratton has been diagnosing and treating patients with endometriosis for years.
It can be very serious to the women concerned. It can affect their ability to have children. It can cause them to take time off work. It can cause pain with intercourse, which can affect relationships quite severely.
Paula Sager only discovered the condition at 30.
I was, by that point, infertile. I wouldn't be able to conceive without IVF. And I'd just reached the stage in life where I was starting to think maybe I should have children, so that kind of knocked that out.
Tina is just thankful that IVF worked for her and husband Adam.
Despite it being a very rough road and being told that we'd miscarry in the very early weeks, our little man held on and has just, been the light of our life.
Do you look at him and think he's a little miracle?
Oh, absolutely, every day. I look at him and just feel something I never thought I could feel.
It's uncertain what causes the disease, and the only effective treatment in Australia is surgery.
How many operations have you had?
It's around 30 now. It's been a very long road.
And even then, there's a chance it will return.
There's never a great day, it's just good and bad days and, degrees of bad. To have a point when I can wake up and not be in pain and actually be able to function like I did as, a teenager and a 20-year-old with, no worries in the world. That would be good.
I think an early diagnosis is important because we can actually try and control the disease before it gets to the point that it can actually affect other organs and cause a lot of pain for women.